Have Dr. Joanne Zabo, a physical therapist with ASDB, presenting to us about physical therapy with school-age students who have cortical visual impairment. And before Joanne begins and tells us a little bit about herself, I just want to say that she welcomes our screens on. She likes to see who she's presenting to. And we do ask that you leave all questions in the chat. And Alyssa will be organizing those into similar topics. And at 3:15, Joanne's going to stop, look at those questions, and then elaborate. And she's willing to come back and present to us on more specific topics next school year. So with that, Alyssa's going to be checking the chat, and I am going to have Joanne tell us a little bit about her background, whatever she wants us to know. Thank you, Joanne, for being here.
Okay, so hi everyone. I can't see everyone, but hopefully everyone can see me. So yeah, I'm a physical therapist at ASDB, and many of you may know me because I used to attend, or I still do, a lot of the AER stuff that's going on. I'm gonna forward my slide here to. All right. So I'm a pediatric physical therapist. I've been a therapist for over 30 years. I worked in all environments, but school-based therapy is my primary area of working. And in the summer, I do early intervention. So I have experience with a wide variety of kids. Um, uh, and then lastly, I serve on the APTA committee for children with medical complexity. And I was a former member of AER here in Arizona, a member at large. So some of you probably know me from that. So anyways, so I was asked to speak today about, well, you guys gave me the topic, which was kind of development, child development related to children with visual impairment and specifically CVI. So I took that topic and I really felt like maybe in this 45 minutes we could talk about vision and development and kind of how those two things are tied together and why really the TBIs and the O&Ms and the physical therapists are really like in bed together with these kids. Like we have to both really work really well together to understand what's going on with these kids. Especially the more research that's done about CVI, the more we know that most of our kids with cerebral palsy potentially could have CVI. So that's the goal here of my talk is we're going to talk about the connection between development and vision, and then towards the end, how that affects our kids with CVI. And then we're going to talk a little bit about how to support those kids and kind of how this whole thing ties together, I hope. And then at the end, we'll have questions and answers. So moving forward, I'm going to first just put this out there with our kids with cerebral palsy and CVI, that CP is the most common motor disability that's out there. It's a movement disorder, and vision obviously is a critical component of movement development. So a visual impairment is going to have a significant effect on the motor development of our kids with CP because they're already struggling to move, right? And then conversely, CVI is the leading cause of blindness and low vision in children. And many of our children with CVI have difficulty with visual motor skills, reaching while maintaining visual fixation, and also the same thing with the feet. And that's kind of where I'll end. I'm going to talk about that at the very end. So as we start, we're going to start with just a child and development and why vision is so important to that process. Okay, so vision is the glue that links really the developmental process together. It's the instigator of action throughout development. And I'm sure you all know that, and I know that when I work early intervention in the summer, so many of the little ones with CVI just aren't moving. You know, they don't have head control, they're not moving, and that's all related to the fact that they can't visually fixate, they don't have the strength in their neck to hold their head up, They don't have the strength, to focus their eyes. So there's a lot of problems with development in that area. So one of the things that I think is important is understanding the research that goes along with these sorts of things. So I just have a couple of research studies in here, but this one I think is really significant. And what this research study found was they took 29 infants with periventricular leukomalacia, or PVL. And so those infants, they followed their progress in development, and they looked at their motor issues. So if they had cerebral palsy, like how well they were moving. They looked at their brain scans, their MRIs, and how much damage was done to the brain that they could see on scan. And they ranked all the things that mattered the most. And in the end of the 29 infants, the children that had the visual impairment ranked poor by far compared to all the other kids. So it didn't matter how damaged their brain looked on the scan. It didn't matter how, significant their physical movement problems were. The number one thing that mattered when they ranked the kids was whether or not they had a visual impairment. So even kids that have a scan that doesn't look great or can't move, if they have vision, they're going to be way ahead of the kids who don't have visual access. So this just really shows that vision is such a huge player in developing for our kids. So we're going to talk kind of now about the development. So the basic components of motor development, right? We have vision is needed to stimulate developmental movement. So the vision is needed. The baby has to be able to see something, catches their attention. They start to look, they start to turn their head, and that movement starts to strengthen the neck. And then that movement starts to send messages to the higher centers of the brain. And as that happens, those early reflexes will be integrated. The more they move, the more the muscles fire, the more it goes into the higher centers of the brain, and then the more they start to integrate those early reflexes, right? So we need that. But then you also need posture and movement to develop visual functioning. So babies have to learn to fixate. They have to learn to track. If they can't hold their head up and fixate, and they can't turn their neck, then they can't learn to look between two objects, and they can't. So on both sides of the coin, physical therapy is affected and vision is affected, because this is like a give and take situation. And if my side's not working and your side's not working, then everybody's in trouble, because nothing is going to be developing correctly. So one thing that's really important to remember is that this process that I just talked about happens until a child is 7. So really, until a child is 7, vision is the key thing that's going to drive development for that child. So vision is what provides the continual feedback to the body, where it is in space, where they're looking, how to hold their head, their postural reflexes. That all happens until age 7. So when you have a child in early intervention, let's say that didn't get what they needed, and now they're starting school, we're still working with those same systems. We're still trying to get that vision, some sort of development happening right in the neck, in the postural muscles, all of those things until age 7. And now that's typical development. Okay. So this is now just going to talk about, regardless of whether it's CVI or whether it's some other visual diagnosis. Right now, we're just talking about, vision is not clear. They're not getting good visual input, or they potentially, could be blind. So when we have visual impairment, regardless of the cause, we have a lack of stimulation to look around, which causes the delay in head control. And we just kind of talked about that. If a baby can't see objects clearly, and that may be more CVI, they're not processing what those objects look like. They might just be seeing kind of a kaleidoscope looking sort of factor. They aren't going to make any effort to move. They're just going to kind of lay there in their own space, because they don't really understand what's happening around them. Again, so babies at this point, they aren't getting any real meaningful feedback. So they're just going to be very passive. And anyone who's worked with babies that have significant visual impairment, you'll know they're pretty passive. They don't do a whole lot of moving outside of their body. The The goal-directed movements are absent, so we aren't getting any strengthening of the arms, the head's not coming up, we're not getting any reaching, the development of the strength in the arms isn't happening. I mean, you may get some spontaneous kicking and things like that that's normal for young babies, but we're not getting a lot of goal-directed, like volitional movements. And then lastly, the incidental learning, right, isn't there. They're not seeing, mom come in and smile or put their hands out to pick them up. So later the baby starts to learn, oh, if I put my arms up, I may be picked up. So all of those kind of things aren't happening. And I'm sure many of you that work in early intervention or have worked in, you know all of this. I'm not telling you anything you don't know, but it's super important just to keep all of that like in your mind when you're working with school age kids, because when a baby kind of goes through all of those things and maybe they didn't have a lot of good early intervention, maybe vision wasn't even involved. I mean, you don't know how many times I get in the summer, somebody will say, oh, this baby's not walking. I'll go out to the house and find out they have a visual impairment, and they never even, ASDB was never even called. They never even got brought into the picture. And I'm just like ready to pull my hair out because I'm thinking, oh my goodness, how did we miss this? But it gets missed all the time because therapists don't have a lot of good training in vision, and other people who are first into the home sometimes just don't understand that, maybe they're not developing head control because they don't have good visual fixation, all those things. They think it's cerebral palsy, they can't move. There's many things that often confuse people as to why a baby isn't developing when they're that young. So the important part here is when they get to school, we don't even know how much intervention they had, where they came from, but you have to keep this in mind, because if babies haven't gone through these processes and now they're in school, we're really like having to move back into the developmental sequence and think about like what have they missed, because they're not going to just they're just not going to magically gain these sorts of skills. So another important piece of information, this is typical development. So at age 7, you're going to ask me like, well, what happens at age 7? Because vision is no longer the primary driver. And now kids at typically developing are starting to look for purposeful movement that's fun, like learning a sport, practicing, tricks, riding a skateboard, riding a bike. They're practicing all these fun things that are no longer really driven by vision. At this age, what happens is our vestibular and our somatosensory systems are now starting to mature. And they've always been there, vestibular more than somatosensory, but they're not well developed like vision, is when they're early. So when the vestibular and the somatosensory systems start to kick in, that's when oh my, that's spam. Let me turn off my phone. Sorry about that. So that's when the postural control actually really starts to develop. So that's when spatial awareness is refined. That's when our adult-like balance reactions start to come in. And that's when, like in typically developing kids, they no longer really have to use their vision. They can look down and still walk. They can maintain their balance while their eyes are doing something totally different, right? Because that whole visual piece has already developed between birth and 7. So at this point, this is what we're looking at. We now have the 3 things that deal with balance for a child. We have vision, we have somatosensory, which is our joints, so where our joints are in space, and then our vestibular system, which is in our ear. And so the important piece to this is when we have kids who maybe have no vision or little vision, and maybe they have a hearing loss or some other vestibular things going on, we know right away that the somatosensory, which is in their joints, is probably going to end up being a primary system that they're going to use for balance. Because if the other 2 can't compensate, at least you have the 3rd one in there. But the big piece to this whole problem sometimes is I'll have people ask me when they're 3, they'll say, well, do they need to go to vestibular rehab? And I'm like, no, because, at 3, our vestibular system isn't even that well developed. So that's not the problem. Typically, it's going to be vision. If they're not balancing well and they're 3, right away I'm thinking vision. It's got to be vision because that's the system that should be providing the majority of our, support for our balance and stuff like that. But this is an important system. So at 7, after 7, this system kicks in. The thing is, if you're a child with a visual impairment or cerebral palsy and other things, your visual system is not going to be well developed. So when you get to this point, it's going to be hard. It's going to be difficult for these other systems to start to mature because we don't have vision in place, right? So now it's going to take longer. The balance isn't going to be well developed. It's going to be developing, but it's still not going to be like a mature adult person would have, like adult-like balance, right? So here's another research study, and this one looked at just balance with youths, like school-age children that had visual impairments. And so what they found, and some of this is kind of obvious, but it's just important that, we know that the research validates this, that limited visual stimulation obviously is going to result in distorted postural control. And we kind of just talked about why that is going to happen. But then balance and locomotor skills really vary by the degree of vision loss. And again, many of us who work with these kids know that's probably the case, but it's good that this is kind of, put out there in research. And what they showed was that the children with mild visual impairment, whether it's through CVI or whether it's some other ocular impairment, they showed an increase in motor skills over time. So practice and, maybe they're getting physical therapy and they're in school, their motor skills slowly but surely increase. But children with severe visual impairments, they actually showed a decline in motor skills over time. And I can definitely say I see that. Sometimes parents will tell me, when my child was 5, they used to walk, and now they're 15 and they're in a wheelchair. And it's because, gravity has an effect on us, and it's much harder for us to balance and hold up a heavier, bigger body than a little child on maybe a walker or something. So, I see that happening, but that's a reality. So we know that, like, our kids that have severe visual impairment, they really need a lot of support in this area if we're going to keep them physically moving and being, like, in a functional situation for their life skills. Okay, so effects of unreliable visual input. So again, this could be any visual diagnosis, including CVI. So what happens is that impairs our visual feedback for movement. So, like, if our kids need to refine their coordination and refine the way they're working, when the feedback that comes in is unreliable, then those motor coordination systems are not going to develop well. They're not going to develop well as far as, and the biggest area that they found in studies is that needing to, like, adjust your hand shape to pick up an object. Then they were basically saying that's the one area for kids with CVI or visual impairment that area just does not develop, like, not even to expect it. Like, typically kids will either swipe or they will come up and, like, touch the object from the top, and then they'll mold their hand around the shape of the object once they touch it, so they know, like, what the shape is. But to visually be able to look at the object and mold their hand shape as they're reaching, for a child with a visual impairment, it's and studies have shown it's just too difficult. That feedback system needs to be really well developed, and it's not in kids that have visual impairment. So we just know that those are some of the things that they may not be developing. Fine, we have to work around that and figure out other ways. And then visual perception is also an area with unreliable visual input. Like, kids aren't really able to sometimes, like, filter out unimportant information. Their visual memory often is not good, and CVI that especially. And then spatial relationships and object discrimination, and that's the same with CVI. Sometimes that can be very poor depending on the circumstances and how it's presented, especially if it's a complex, cluttered environment, then that's not going to happen. So those are the things we kind of have to keep in mind for some of our kids. But then going to the extreme, so, like, if you have no visual input, the effect of that on development, and I'm sure many of you have seen kids like this, right? There's no extrinsic motivation whatsoever. They're very focused on themselves. They do a lot of rocking and eye poking and hand flapping. They avoid like unstable or disturbing situations. They don't, they might have run into something at one point or hit something, and then the minute something like that happens, they typically just kind of fold back into themselves. And there's really no attempt at exploration. So we know from looking at these kids, and I have one more example, there's another one. I mean, that's really what happens when we don't have visual input, for our development. They have the retained primitive reflexes. They have poor muscular develop of forward head, postural compensations. All of those things happen when we lose vision to help stimulate our development. And it's very difficult, especially when you get kids like this and they haven't had a lot of early intervention. And now, they're coming to me and they're saying, we want you to get them to walk. And I'm like, oh my goodness. Okay. So if we haven't crawled, we haven't done any of those things, it's very hard for me. And a really good example is here. Once they get to become a teenager, then I get this. I get a call of like, hey, the parents want this child to walk. And I'm like, you can't expect if we haven't done all of our work along the way. So here it is, the interdependence between posture and movement and vision becomes very obvious when we have these older kids that have no postural control, because postural control and eye control are mutually dependent, right? Regardless of the diagnosis, the body mechanics are absent. And really, really a good indicator for me is if a child, I, go into a class and the child actually has some amount of head control, that tells me there must be some amount of vision typically. Like there's some amount of vision, probably not 100%, but there's something there that's helping to stimulate that child to get that head up, that's, to work on those postural muscles. So this is just kind of, going through the process, but it's a real thing. It happens a lot where parents, they get to a point and they want their child to walk, but really we have to go back to those early developmental days and what didn't happen for those kids. So the thing that I want to leave you with, when this isn't over yet, but I'm just saying one thing I really want everybody to remember is that a key moment in development for a child with a visual impairment, whether it's CVI or it's an ocular condition, is a child must be able to reach out to grasp a sound cue. There's lots of research out there, and I have a bunch of articles on this presentation, that if a child cannot reach to a sound cue, the child will not walk, will not walk. So those two are linked together. And not only will they not walk, but they also have to understand, the reason they have to understand the sound cue is because of object permanence. And if a child doesn't understand object permanence, then you're looking at the two kids I showed you that were just sitting there. They don't understand that there's anything outside of their world. And so it's super important for a child, regardless of their age, to be taught about object permanence. So reaching out to a sound cue, this is a quote here, this is the catalyst for all subsequent development, and that's very true. If object permanence will not develop, right, until the child can reach out to a sound cue, and mobility will not occur until this happens. And the reason is because the child does not realize that there is anything outside of themselves. Until they realize that something can exist, can permanently exist outside of themselves, will they then start to reach and explore. And so often I'll talk to people about, I'll have a child that maybe is even in middle school that doesn't understand object permanence. And I'm like, we have to try to really work on that skill, because that skill opens up a lot of things for children as far as understanding that they can reach out and touch things and things exist. And then they can start to move, if it's possible, outside of, their base of support. So now this brings me to CVI, because people will say to me, well, what about kids with CVI? Because there's a lot of kids with CVI who don't reach out. Well, that's true. because when you're in phase 1 of CVI, you're just learning to use your vision for function, right? So you're learning to fixate on an object, you're learning to look, you know, to the left, to the right, up, down, and to maybe track across midline, and then to look between two objects. And we don't expect, and I always try to remind people when they're setting goals for young kids or anyone that's in phase 1, do not set any goals for them to be reaching and touching things, because that's not going to happen with a child who's in phase 1 of CVI. It's just not going to happen. They're not there. Their brain is still just learning to use their vision. And that's where we have to focus, right? We have to get them really good at using their vision. And hopefully, if they're little, or even if they're a little older, they can start to hold their head up to use their vision. They can start to develop those neck muscles. They can turn their head side to side. All of those things that we need them to do, even though they're a little bit older, they still need to do all those things to develop all those postural muscles. And so then if the child is in phase 2, that's where we are using vision for function. So that's when we would start to expect a child to potentially be able to reach out to a sound cue, to be able to reach out, and that's where that whole sound cue thing, that's where that's still important here. But sometimes, as you know, kids with CVI, they can't reach and they can't look at the same time. And so people will say to me, well, how am I going to do that? Because they aren't reaching and they aren't looking. And then they'll say to me, can you set a goal that you can work on them reaching and looking at the same time? And so then I have to explain to them, really, that's a process that's going to occur naturally in the brain as the brain starts to mature and the vision starts to get better. Hopefully those two processes will start to come together, but we can't force that. We can't force that to happen any faster than the brain is going to make it happen, if it's going to happen for that child. So visually guided reach, and hopefully, I'm assuming everybody here works with CVI and is aware of that. So, but visually guided reach is one of the 10 characteristics of the behaviors of CVI. And the reason it's challenging is because it requires the brain to process 2 different sensory inputs at the same time. So it's requiring the brain to process tactile information along with visual information. And as we all know, with some CVI kids, they can only process one sensory system at a time, especially if they're in that earlier phase. Like, sometimes there's too much noise, it shuts down their vision. Sometimes there's too much clutter, it shuts down their vision. Something's too tactually, there's a lot of tactual stuff going on, they're not going to be able to look at it. So this is why the visually guided reach is sometimes not there, because they cannot process 2 systems at the same time. And that's okay. Like, we can't force that. Like, as a child develops along the way and the CVI, starts to resolve, it will resolve on its own if it's going to. And so here, what I wanted to define for visually guided reach, let me finish this slide, was the ability to simultaneously look and reach, right? Or the ability to simultaneously look and tactually interact with something. And so that's an important piece. And we'll talk about that a little bit more in a second. But the absence of visually guided reach, so first of all, that indicates that this is a brain-based problem, right? It's a problem with processing spatial information, and the brain, because that's what CVI is, right? The brain is not able to process kind of 2 different sensory pieces at the same time. And maybe we're even requiring them to process 3. If there's sound going on in the classroom, and then there's, we're trying to get them to look at something, and then we're trying to get them to touch it, that's actually possibly 3 different things that we're asking them to process. So, but anyways, the absence of visually guided reach, it affects the voluntary motor control. And like I said, it's not something that can be forced. So here, the child, this is a kid I worked with, and this was his thing. So he would fixate, he would look away, and then you see him here, right? He'll reach. So he knew darn well where that button was, but he will never look at the button and push it at the same time. So he would look at it, then he'd look away, and then he would hit it. And he was really good at, he knew exactly whatever it was he was wanting to touch, he knew where it was. It's just he couldn't look and touch at the same time. But sometimes they'll look, they'll reach, and then they'll look away, and then, or they'll feel it, touch it, and then look at it. So like any of those combinations is still the absence of visually guided reach. Whether you touch it first and then look at it second, whether you look at it and touch it and then look away. But either way, that's the visually guided reach problem. And so for kids developmentally that have CVI, so they're going to go through kind of all the things we already talked about with needing to use their vision for development. Obviously, the vision isn't giving them reliable information. So we know all of these things are going to be affected. Once they hit 7, we know that their somatosensory and the vestibular systems are trying to develop, but those aren't going to be well developed either. And then you come into this, well, we need them to know about object permanence for sure to get them moving more. And we need them to reach for sound. But now we're dealt with this problem with CVI is they're not reaching really because they've got this other problem with the sensory input. So the piece that's important for these guys is, first of all, for CVI, and look and reach, our biggest, not so much mine, but you, TBI, the biggest thing there is for you to continue to control and reduce the complexity like in their environments, right? So that's what we can do to help the child, or I can do if they're in my PT gym and I'm trying to get them to maybe reach a ball. So we really have to control the sensory environment. We have to control the noise if we can. We have to control the characteristics of the object presented, because whatever they're reaching towards, if there's too much going on there, that may shut down their vision. And then the array, of course, if they can't reach and look, we're going to only want to have an array of 1 for sure. And so you got to make things really simple. Presenting something on a plain black background at this point is still super important. So it's like as simple as you can make it for the vision and as simple as you can make it for the tactile piece is your greatest possible chance of getting them to potentially marry those two things together. But the minute you add too much complexity with vision or too much complexity with tactile or sound in the room, then you're potentially going to shut down the system because it's requiring too much to happen there. Also, you can use your strategies, whatever you've determined as the TBI. So whatever those strategies are that help the child to look, you can try to use those as well. Like you can add some movement to the object. You can make the object shiny if that's what, that's what gets their attention. You can use a backlit device or an iPad. If, that's still kind of questionable because they probably aren't working on 2-dimensional objects yet, but still you could use a backlight and maybe have something on top of that if light is something that still kind of gets their attention. You can capture the salient features of whatever it is you want them to look at, or using color as an anchor if their favorite color is red. So you still want to try to use all of those strategies to encourage them to look and touch. But the bigger piece here is our kids that have like multisensory complexity, right? So again, we're going to go back to those kids that have CVI and CP. And now you're like, well, they can't move their arm. They can't extend their arm. So how are we going to get them to reach and know that things exist and to work on object permanence? So it may not be possible physically. And that's where we either employ hand under hand if they'll accept it. That's a little more invasive. Hand at the elbow is less. This particular child, he didn't mind grasping on to, my hand. So he couldn't extend his arm per se, let's say, but he was kind of watching what I was doing and he was holding on to my hand. So that was perfectly fine, so those are the kind of things that we use to kind of continue to work forward with this, reaching and looking type of thing. And also one of his favorite colors was like a neon green. So you can see that's why we were using neon green paint And he was in a stander at the time, so we were working on standing as well, but we were trying to do some visual stuff at the same time. Um, and then here, so again, difficulty with this complexity. The important piece is, so learning, right? Learning is our goal. Looking isn't necessarily the goal. Looking and reaching isn't necessarily the goal if it's not going to happen for the child or if it's still too difficult. So the the goal is learning. So what we do is easily we can, if they're willing to touch something, we don't need them to reach. I mean, the goal is if they can touch and they can look at that object while they're touching it, then we're putting those two sensory systems together at the same time. And that's the first step. So even if you just put it in their lap or they're willing to hold it and then they're willing to bring their eyes down and look at what they're doing or watch, hear this, he's sitting between my legs and riding my hands. And I was kind of sliding my hands out as much as I could to get him to like touch the ball. And he wasn't really looking at it at all. But the goal was to kind of play and move and trying to get that visual attention down, like onto the hands and onto the ball. And for this particular child, yellow was his favorite color, but at the time it still wasn't helping me get his visual attention down. But that's where we're going to start, right? For these kids that have multiple disabilities and when the reach and the look isn't there, it doesn't have to be a reach. It's really a touch and a look. And then you might be able to move it out a little bit more and get a little bit of a reach and a look or, work on that in the future. But really, it's just getting those two things coming together for that characteristic that we're talking about. Okay. So what about the feet? Because people ask me this all the time because I'm physical therapy. And actually, it's the same dorsal fibers in the dorsal stream that are responsible for moving the hands for the look is the same area that's responsible for moving the feet through space as well. And some kids will not have problems in both areas. Like they may not be able to reach and look, but they may have a good sense of where their feet are in space. And then other times they can reach and look pretty well, but they have no idea where their feet are in space. So it's less talked about, I think, but it's still a significant issue for kids and development with the kids that have CVI. So what happens is some of those dorsal fibers in the dorsal stream are responsible for knowing kind of where the feet are and how they should be moving through space. And when this happens, their leg movements are not real accurate. They often run into things. They appear clumsy. People will not realize that it has to do with their vision. They think they have, developmental coordination disorder or something else going on, but really it's their vision. And so the impaired visual guidance of leg movements is often associated with that lower visual field impairment, which we see with many of our kids with CVI. So not only are they not really knowing where their feet are in space, they're also, they can't see, down here, down at the ground, which is a big problem. So they will appear clumsy, they'll trip, they'll run into things. They often depend very heavily on rails or walls to, hold on to because they're not sure where their feet are. They will use the technique of like putting their heel against the back of the step and like sliding down the step so they know where they are on the stairs. They often like over or under step on surface changes, and they'll do a lot of like toe tapping, that they know they're at a surface change and they'll tap their foot up and forward to try to figure out like, is that a surface change or I saw something dark? Does that mean it's a stair? Sometimes they aren't sure if it's even a depth. The depth perception is off. They don't know if it's a drop off or just a change in surface. And that's hard because they can't see right below them. They're looking out in front of them. So strategies to support the students obviously is using a white cane. That's super important if that's the case. Step counting, if it's a familiar environment or a classroom, they know how many steps they have to go up and down. This is a picture in my gym here. I use bright colored like duct tape all the time. It's all over the place to highlight like the beginning or the end of steps or rails, things like that, just to kind of help give a visual cue to a surface change or just something you want them to be looking at. That's super important. Then these other obvious things would just be avoiding cluttered or highly patterned spaces, like really patterned carpeting in a hotel or something is like disastrous to some of the kids that have cortical vision impairment, even adults too. Like traveling during off times, like, asking the school to let the kids travel like before lunch, a little bit before lunch or after, so they're not with a large group of people when they're walking around and it's hard for them to kind of distinguish where they are in space and there's too much happening. And then using the toe tapping technique to check is important if they need to. And then obviously providing verbal cues if you're working with them in new environments so they know when to step and what's happening. Okay, so I started with cerebral palsy and CP, cerebral palsy and CVI, and how, these two things are so intricately kind of wound up together. And this is just a quote from the Cerebral Palsy Research Network. That was 2 years ago now, but that people with CP are 3 times more likely to have visual impairments, and up to now they're saying 87%. A few years ago it was like 30 something and 40 something, and now it's like 87% of people with cerebral palsy have some sort of visual perceptual dysfunction from CVI. And just recently I heard, I want to say it's Germany, there's a country, don't quote me, that literally passed some sort of law that said if the child is diagnosed with CP, they also are diagnosed with CVI. Like they get them both together no matter what, because they feel like so many kids with cerebral palsy have some component of CVI. It's so hard to, as you guys know, it's so hard to diagnose kids with CVI. It's just a hard thing to have happen because there's no specific testing for it. And it's challenging and it's still very new to many people. Okay, so 3 minutes early. So this is my last slide. In the early months, looking is half of living. And that is true. And that is why it's so important for development. So that's it. I'm ready for questions.
Thank you, Joanne. That was wonderful. So, Alyssa, are you going to then present the questions?
At this point, there are no questions yet in the chat. So
Oh, good.
let
I
it.
answered everybody's.
You did amazing. But this will be a moment for those of you that do have questions to put them
Yeah.
in the chat. We've got some time.
Yeah, we have like 15 minutes, right? Or if you have questions about whatever, I can try to answer them, but I don't guarantee you that I can, but you can ask.
Hi, Joanne. This is Kelly Wilson. Can I ask a question?
Yeah.
Okay. It's not specific to CVI, but I think it's PT and VI kind of related.
Yeah,
I've
sure.
had kind of an uptick in PTs asking me for support when a student has visual motor difficulties, specifically with like catching a ball. What besides like providing kind of like visual accommodations, what I guess in your opinion as a PT, do you feel like the vision professional's role is in something like that?
So, well, does the student have a diagnosis?
I've had this with probably like 4 students now.
Okay.
All of them, none of them have had CVI. It's all been like strabismus,
Oh, okay.
astigmatism, like nothing, I guess nothing to me that's like super
Okay.
major. But they're looking for input because the student does have some type of a visual impairment.
Okay, but it's not like it qualified them for having TBI in school. It's
No,
just okay,
no.
that's what I was trying to get at.
Yeah.
No. Okay. So, I think, and you're talking about specifically about catching a ball. Is that the skill
Sorry,
that
I
they're
just
having?
muted myself. Yes, not anything visual motor. There's been like they can't catch a ball, throwing a ball, like some, yeah, I would just say visual motor concerns.
Okay. Well, in that case, my go-to would be, and I don't know the age of the students we're talking about, but I would I would say if they're working on like catching and the student is not doing well with catching, I would do one of two things. I would either tell them, well, ideally they would have like a jingle ball or something that has some sound. So even though the student doesn't have a total visual impairment, it gives them another sensory system to kind of help them track the ball that's coming to them, right? Like they can hear the sound. So for
Mm-hmm.
me, I would have them sit down on the floor
Mm-hmm.
first, and I would have them just work on rolling it and watching the ball, coming and like stopping it and rolling it back and forth in that sense, like because that's how you first get that motor planning and like
Yeah.
anticipation. Here comes the ball, and then get it. If they don't have like a jingle ball or something like that, then maybe they could use a ball that's like red or brightly colored, just something that's, easy to see, easy to spot, and they can work on that same thing. If the other option, if they want them standing, then I would tell them, in my mind, I would use like a Mylar balloon, like a from the
Yeah. Yeah.
dollar 25 store or whatever it
Mm-hmm.
is nowadays. And it's shiny, yeah, like red or silver.
Yeah.
And that way it goes very slowly, and so you're
Mm-hmm.
working on having them throw it up and having them look at it visually, and then and then trap it to their body. So either you have to slow down the ball in the air so they can visually work on that, or you have to sit them down if you want them to work on, like, because they can't. The problem is you're having them have to work on their balance, right? And we've already talked about, if they've got some kind of visual problem, more than likely their balance is not well developed. So if you're trying to force them to do a balance activity, which is like watching a ball, and
Mm-hmm.
those two systems are probably not working well together. So either you slow the ball down or you sit them down so they aren't having to work on their balance, and then let them work on just that, like that motor planning piece of, here it comes, grab it, here it comes, grab it. And then once they get that, you might be able to put them on their knees, for example, right? Like have them do a tall kneel and roll it back and forth in that position
Mm-hmm.
before you have them stand up and have to do posture and, visual motor stuff together. So
Okay. That was
those
helpful.
would,
Thank you.
yeah,
Yeah.
those are the ways I would. And if you can't get a Mylar balloon, maybe you can get a beach ball or something, and half
Mm-hmm.
deflate it. So it's not, you just want something that moves a little bit slower for them. I mean, I have, those things from APH, the crinkle balls, but a lot of people don't
Yeah.
have those things that they can
Yeah.
use. Like, but so just go with something like the $1.25 store. I get beach balls and,
Mhm.
Mylar balloons. So
Okay. Thank you.
sure. Anybody else? No? I can't see the chat, so I don't know if,
No, Faye made a comment that the
oh,
info about walking and needing to have a visually or auditory guided reach was interesting. But no, no other questions at this point.
hmm. Well,
I
I
have a
hope,
I have a
oh, go ahead.
question as an
Yeah.
early intervention provider.
Oh, okay.
So, kind of not pertaining to CVI because we're already sort of implementing all the CVI
Yeah.
strategies, but
Hmm.
I often even for kiddos who are totally blind will offer suggestions for families to,
Yep.
in addition to having auditory components to the thing we're trying to have the child interact with, often have families suspend things from like toy bars that are in contact with a baby's body
Yeah.
just to help with body
Yep.
awareness for body and space.
Yes.
Do you have any other suggestions along those lines that we might not know of for
Um,
helping with body and space related to totally blind kiddos or kiddos who are real early CVI stage phases?
so the toy bar with things hanging down, that's common. The other one though that I think works really well are the cummerbunds, which are like just a piece of like felt, and then you take like like a stuffed animal or something, and you just Velcro it to it. It's like, right. Some people make bibs. They'll make bibs
Oh,
and they'll
yes,
put a
we've made some of those with the Velcro strip for adhering
toys.
to their
Hmm.
chest. Yeah.
But like the cummerbund under yeah, the cummerbund is another one that is just, it just goes around them, and you can put more things because it's more like right along their belly, kind of where the hands go. and it just
Mhm.
Velcros, and you can put like Velcro on it. And that way, naturally, if they bring their hands in, they can feel things that are like attached to it. I like using those a lot. I think they work well. Um, the toy bars are good, except it's hard because sometimes they aren't still yet willing to kind of put their hands up. They're more out here, in this position, which is
Oh,
harder.
I meant
Oh,
things suspended all the way in contact. So like we'll have parents buy those little links so you could link it
yeah,
all the
yeah,
way
and
down to
hang
their
them all the way
chest or
down. Yeah,
position it
yeah,
wherever their hands fall. Yeah.
right. Yeah.
Sorry, I didn't
No,
say that
no,
very well.
no, I knew what you meant. I knew what you meant. I just meant sometimes
Okay.
I go into a house and I see that and they still aren't touching them because their hands are like out to the
Removed.
side. So then either having them lay them on their side, and try to have something like that there, or because side lying is so important too, right? So I sometimes I'll have them put a
Hmm.
roll up a towel and put it behind them, put them on their side, and then
Mhm.
in front of them, right there where they're lying, have you can have just a piece of a little blanket or something where you have stuff on that, because they're not going to reach up and get the toy bar when they're on their side. It's harder, but they
Mhm.
are very
Right.
well positioned to like touch whatever is right in front of them, like
Mhm.
right there.
Right.
So that's another way to get them to start like interacting naturally, right? Just randomly kind of running into
Hmm.
it. Um, and then the other, so did that answer your question to some degree? Because you were saying other things like, or
Yeah, I just didn't know if you had any other strategies because I think as early intervention providers, we're kind
yeah,
of providing all of those.
yeah,
And yeah, I often do sideline just because that's the easier
yep,
reach for kiddos, right?
mm-hmm,
Not
mm-hmm,
against gravity.
yeah. So
Thank you.
it sounds like you're doing everything. The cummerbund's the only other thing for the little ones.
Mhm.
And then just
Yeah,
have,
Alyssa made us oh sorry.
no, go ahead.
Alyssa made us some t-shirts that we kind of cut the armholes out of. So it's almost like a bib with a very
Yep.
big, like rectangular piece of Velcro. So it kind of goes from
Okay.
chest down to belly. So it's,
Yep.
a big, huge area for the
Hmm.
hands to be able to access.
I think anything like that works really well. And then teaching the parents how to, I think one of the big, I don't know, I mean, I think one of the big things that sometimes parents miss, and again, I could be repeating something that all of you already know, but when I go in as a physical therapist, sometimes, I'll see the parents trying really hard to get them to touch something or putting something in their hand or wanting them to, manipulate things, but just educating them on really about the whole idea of just having the child hold on to the parent's finger, right? And then have the parent hold whatever the toy is, because
Mhm.
that's the way they're going to feel safest. So if they're just holding the parent's finger or hand, and then the parent is holding on to the brush or the stuffed animal or whatever it is, and then their hand is just kind of randomly touching a little piece of it, that's like the best way to start, right, with exploration. So trying to use the parents more as the tool to like help with that versus the child just, randomly doing it on their own.
Mhm.
Awesome. We've got another question.
Sure.
It says, if head control means some vision, does no head control mean no vision?
Well, potentially, I mean, if there's just no head control, then that may mean no vision. Although, I mean, I have to say that with, as we know, with kids, it could be that there's a lot of other stuff going on with their
Mhm.
muscle, right? I mean, they could have some severe injury to the brain and they just aren't going to be able to gain control of their neck muscles, or they may be just using a lot of primitive reflexes, extending way back and then flexing down and extending way back and flexing down, and that probably has not that doesn't have anything to do with their vision, but it's going to affect them visually. They're not going to be able to like learn to fixate really well. So I would say, I guess the thing is, when I see them developing some head control, that usually tells me that there's something there that they're visually attending to. But going the opposite direction, you could maybe make that as one, okay, possibly this means we really don't have a lot of vision happening, or the CVI is so severe that, they really Maybe they're just using some peripheral vision at that point. I mean, it's hard to know. So it's kind of a wishy-washy answer because we don't really know. But I will say with kids that are a little bit older, if we still aren't seeing a whole lot of head control or movement, often those are the kids that don't have any vision in the end. So I can't give you 100% answer there, but it's just one of the things that helps us kind of gauge what's happening.